Today we have a special guest and subject matter expert, Ashley McGirt, CEO and founder of the Therapy Fund Foundation. How are you, Ashley?
I'm doing well, excited to be here.
Wonderful, wonderful, wonderful. I know you're constantly traveling around the country, presenting and training, and I'm so happy that you've found some time to connect with us. And I just want to jump right into these questions.
Awesome.
All
Sounds
right.
good.
All right, here we go. Can you provide an overview of what racial trauma looks like in healthcare and other work sectors, considering both providers and patients?
Yeah, so when we're looking at racial trauma in healthcare, the workplace, in our personal, professional lives, it really can manifest itself in a number of different ways. But when we're looking specifically at the healthcare system, which is the
Mhm.
system in which I'm a part of where I work, we see a lot of discrimination, we see a lot of bias. Healthcare providers of color face discrimination working. Our patients experience it from microaggressions, macroaggressions. My little bit of bias, I believe they're all macro because any form
Mhm.
of racial harm is harmful, no matter how little. So I have a little bit issue with that
Right.
word microaggression.
A little issue. Gotcha.
But it really just, erodes a person's sense of professional identity, their
Mhm.
competence, their well-being. And when we go into the healthcare system as Black people, as Brown folks, when we are talking about problems that are going on with our body, we're often not seen, we're not heard, our pain is minimized. Or when we are experiencing pain, they've oftentimes because of racial bias, because
Mhm.
of stigma, we are put in a position to where we're considered drug seeking. There's a lack of support. There's health disparities. There's so many levels of trauma, from racial trauma, vicarious trauma, complex trauma, all compounded when it really comes to looking at how racism, essentially racial trauma, shows up
Mhm.
in the healthcare system, as individuals, as a collective society.
Mhm.
I did a hospice therapy for a number of years. And
Oh, okay.
oftentimes, the amount of racial trauma that I would see when it came to my Black
Mhm.
patients who were disproportionately dying at young ages. In comparison with their white counterparts. And what I would often see is folks who are poor on Medicaid, who are disproportionately Black and Brown, being asked to be put on hospice in a way to make them feel comfortable, because if they're going to take aggressive treatment, it costs more, all of those different things, and they don't
Mhm.
have the support, they may not necessarily have the education, and it's really a system of systemic racism that's embedded in the healthcare system that patients experience, that causes them to really mistrust the system,
Mhm.
avoid it at all costs, which is why we often see people of color not going to the hospital, not going to see doctors, not going to see clinicians, therapists like myself.
Mhm.
There's a disrespect, a devaluation of the individual, and just poor quality of care. And all of these things
Mhm.
equate to racial trauma. And I'm just talking about healthcare. I haven't even got to
Right.
the workplace yet. you know,
Right.
but you also
Right.
asked about the workplace. And so add all of that if you're a provider working in healthcare, or if you're working in education, or you're working in hospitality, you're working in any industry. But because we are talking about health specifically,
Mhm.
I personally have experienced hostile work environments, being
Yes.
the
Yes.
only Black person in a position of leadership, and what that is like, also being a woman, and all of these other things where people just do not respect you. They want to see your credentials, they want to see your degrees, but they're not asking your white counterpart to pull out their transcripts in the same manner in which you are. And it's
Mhm.
so embedded deeply in the community that we experience it often from other people of color as well. Um,
Mhm.
we have to hold a lot of emotional labor. There's a lot of tokenism, marginalization in the workplace that individuals experience, or When you're the one Black person in your work environment, guess what? Now you're the head of the DEI committee because you're the Black person. So guess what? On top of seeing all your patients, on top of writing all of your notes, on top of doing all of your tasks, now you're expected to head this diversity, equity, and inclusion committee because you're the only person of color there. You may not even have any experience, but you just were deemed that person, and you're still expected to do all of your normal duties. You're not getting any extra pay for these things. You're often presented with questions about other people of color that you're responsible for answering or educating other people, and not really getting rest. So this is how racial trauma shows up in the workplace, how it shows up in healthcare. And it's racial bias, you know. A provider may be well intentioned, but because of those things, it shows up and it causes harm.
Wow, powerful points there. How does racial trauma contribute to burnout among both healthcare providers and patients?
Wow, how much time do you got?
Go
It
for it.
contributes in a multitude of ways. Um, you are showing up, you're trying to be the best person that you can be, for your community, for your patients. Then you're experiencing these macroaggressions. You're just trying to do a good job, and you're put in these positions where you're discriminated against, where people devalue you, where they don't see the humanity in you. And that takes an emotional toll on a person. And which honestly, that is why I contribute so many Black and Brown folks to experiencing chronic stress related illnesses. Strokes. My grandmother died from a stroke, and she was extremely stressed out. And she worked in this racist environment. She experienced so much racial trauma. And my grandma is not a one off. This is what's happening in our communities. When we look at the statistics, when we look at the mortality rates, we see that Black people are dying at disproportionate rates, and it's really attributed to racism. You know, the leading cause of strokes is stress. So we're seeing this, and that's how it's showing up, and it's causing folks to just burn out. We're tired of having to advocate, to be the voice. It takes so much toll on a person psychologically, especially when you're the only one or the first. We're still having a lot of first in 2024.
Yes, we are.
Lack of support, a lack of culturally responsive clinicians available.
Right.
So many providers are overworked, just burnout, a lack of equitable pay. We're having to work 10 times as harder than our counterparts, and we're receiving less pay. So that really contributes to the level of burnout.
Wow. And you kind of segued into another question that I was going to ask. When I was about to ask you about, discussing systematic issues within the model that can perpetuate racial disparities in care. You kind of touched on that a little bit. Could you go a little deeper on that?
Yeah. So when we're looking at systemic issues, health insurance disparities, people of color are more likely to be uninsured or underinsured. Those are things that we're seeing. There's lots of geographic barriers. Is there a hospital in a quality hospital in
That's a
your
difference.
community?
There is a
Exactly.
difference.
So how far do you have to drive and commute to get there? Is there a bus stop available for you to get there? We've got language and cultural barriers, implicit bias, which I already talked about that a little bit, but just a lack of cultural responsiveness when it comes to healthcare providers that really result in misunderstanding, miscommunication, inadequate care. We've got patients from diverse racial and ethnic backgrounds. And when you don't see someone who represents your community, and not just represents your community, but understands it, because we have a saying in our community, not all skin folk are kinfolk. And just because you're another person of color doesn't that you're not going to uphold white supremacy and other systems of harm that are going to attribute
Mhm.
to my racial trauma, my overall trauma, which is going to impact my health and well-being, my longevity, all of these other things that are going on. So those are a lot of the systemic issues, socioeconomic factors, finances, environmental exposure. Do you live next to a freeway? The fact that your zip code will determine how long you will live is a problem in this world. Do you live next to an airport, and the fossil fuels and all of these things that attribute to your lifespan all impact, and there's structural issues. Our communities have been gutted, freeways have been put in there in the
Mhm.
environments where we live, and that
Mhm.
causes so much harm. There's really just been a whole lot of historical trauma. I highly encourage everyone to read Medical Apartheid. If you haven't, it talks a lot about the trauma that was been done on Black bodies and how that impacts us, and
Mhm.
ways in which we need to really address racial disparities in healthcare and these systemic issues, the criminalization of health from our policies, our practices that are currently in place, leading to, overrepresentation of Black and Brown folks in the criminal justice system, and
Mhm.
circling in and out from prison to the hospital, prison,
Mhm.
hospital, psychiatric
Mhm.
facility. And it's just a perpetual cycle of harm. And we know that when one person in the family is incarcerated or even hospitalized, it
Mhm.
impacts the whole of the family.
Exactly. Exactly. Are there effective methods or tools for measuring racial trauma in healthcare settings, both among providers and patients?
In terms of measuring it, there's not a lot of methods or tools. It's fairly new. So the concept of racial trauma is new. The act of racism, of racial trauma, has been happening since longer than I've been alive. Um,
Mhm.
there's limited research in the area. And so when you're looking at healthcare, now we've finally kind of mandated it to where we're asking individuals the PHQ-9. And if you're not familiar with the PHQ-9,
Yes.
it's the basic assessment of how are you feeling, just to kind of scale how your mood is. Are you feeling depressed? Are you feeling suicidal? We don't have any type of measuring tool as it is for racial trauma. It's really going to be that narrative, those qualitative studies, those individuals who are getting trained, who have a background, who are working to
Mhm.
practice from an anti-oppressive lens and are asking the right questions. I
Mhm.
wouldn't say that there's effective methods or tools at this moment. I think we're working on that. There's a lot of practitioners like myself who study racial trauma and who are creating the tools so that we can measure it and we can see it. We can measure it in other ways. We can look at the death toll.
Uh, Absolutely.
Yeah,
That
so
don't
there's
tell you that.
other
Right.
ways, but it's not effective. It's not
Right.
effective if we've
Right.
already passed away
Mm.
at that point, and then we
Right.
can go and we can see the cause and the correlation. And then there's so many other things. It's both and. There's all of these different systems impacting, but no, I would say there's not effective methods to measure in the healthcare system. And I hope that we get there to a
Mhm.
point to where we can see it, and we're checking these providers, these clinicians who are doing harm, and there's corrective action up to
Mhm.
termination, and
Mhm.
we're not standing for it. And we're putting people first, we're putting humanity first, and that's what I would like to see. But right now, having worked in healthcare for over a decade, I don't see it. People just learned racial trauma a couple years ago during the George Floyd protests.
Right. Right.
This is a new word people are starting to talk about.
Correct. You're absolutely right. How can healthcare organizations use this data and information to identify and address disparities related to racial trauma?
Well, I would say taking the data of the impact. I mean, just even looking at basic ACE scores, your adverse childhood experience. And we know that if you have an ACE score of 6 or higher, Your social determinants of health are impacted.
Mhm.
Your lifespan is literally cut by 20 years just by having these
Mm,
adverse
mm, mm,
childhood
mm.
experiences,
Right.
which mostly impact communities of color. So when we're looking at these data and these
Mm.
tools and the disparities, the geographic neighborhoods, why is it that there's one neighborhood literally right next to one another, but it may be predominantly white or wealthy, and they fare far better than the other community? They're living longer. My husband's from Flint, Michigan. They
Okay.
still are suffering from the water crisis, but the town right over, Grand Blancs, Ypsilanti, they had a water crisis. They put in a 10-year plan. They repaired those pipes. They got those people, and they have good water now. But guess what? They're predominantly white. Meanwhile, Flint, which is predominantly Black, is still struggling to this day, still does not have clean water. I can give you so many different scenarios from all around the world, all around the globe, Puerto Rico, New York. There's been so many different studies that show that. So I would say folks need to take those studies, those data, those tools, and come up with a system so that we can improve our healthcare system and really advance health equity for all and improve the mental health and well-being. Isn't that what is written into our Constitution, for us to have this the joy, all of
Mhm.
these things, but
Right.
everyone has not been experiencing that.
Right. How can integrative healthcare approaches contribute to addressing racial trauma for both healthcare providers and patients?
Integrative healthcare approaches can play a crucial role when it comes to addressing racial trauma for both healthcare providers, when we're looking at providing holistic care, culturally responsive care, practicing
Mhm.
from an anti-oppressive psychotherapeutic lens,
Mhm.
addressing the whole person, our physical, our mental, our emotional, our spiritual. Oftentimes, we're really looking at these evidence-based practices, but we really have to begin to decolonize the healthcare system
Mhm.
and look at some of the indigenous practices, African-centered healing practices, things that have helped our communities stay well, but
Mhm.
may not necessarily be recognized through Western medicine. And that takes a culturally responsive care team that will implement that. It takes being trauma informed, really understanding how
Mm.
trauma shows up in the
Right.
body, how
Mhm.
trauma impacts all individuals, from different communities, different race and ethnicities, different LGBTQ, all of these things, really taking into consideration mind body practices and including
Mhm.
the whole team, making sure that there's consistent trainings. And I think when we have an interdisciplinary team that is really involved and sees things from the full picture. I have an MSW, a master's in social work, and we tend to see things from like a micro macro lens. So we're looking at um, the full system. You've got the individual, the community, all of these things and how they play a part. And I think oftentimes in America, we've become very individualized, and we'll look at the individual and the person, and then we'll have these care teams who are still looking at just the individual and not the whole system. Or they'll
Mhm.
see the system and it seems like it's beyond them, that there's not anything that they can do. And
Mm.
if we're looking at integrative healthcare approaches and how they can play a crucial role, it's going to be looking at the whole system, the whole person, seeing what else can we implement. I had an individual, if I can speak correctly, that I was just talking to who's been really
Mhm.
struggling with high blood pressure. They're taking a lot of medications. And then it's like, okay, well, have we looked at other practices, other things that can really assist with high blood pressure? Of course, you want to exercise, drink more water, but what about cupping? What about acupuncture? What about some of these other tools
Mm.
that
Mhm.
aren't necessarily talked about? Or I
Mhm.
know acupuncture is more recognized and cupping is starting to get out there, but there's other tools and other ways in which people have stayed well. And I think that's how we stay well.
Good deal. Thank you. Thank you for sharing that. How can cultural competence training be integrated into healthcare to raise awareness of and address racial trauma?
It needs to be mandatory, and we really
Mandatory.
need to move from cultural competence to
Right.
cultural responsiveness, because it's not possible to be culturally competent in one area. It needs to be more than one-off 1 hour training or half a day workshop that we do
Mhm.
once a year. It needs to be consistent. We need to be checking in when we're having those one-on-ones, when you're doing your employee reviews, and we're asking, how has culture shown up? In what ways have you been responsive to the identities of your clients and who you're serving? And oftentimes when we're working in environments where maybe it's a predominantly white environment, there's not people of color that come in, folks don't really feel the need to take on this training. And I think even if you're in an environment where you don't see a certain population, you still have the onus to stay up and continue your knowledge, continue learning. And it definitely needs to be a requirement, a certain amount of CEUs, education credits put toward that, so that folks are really ensuring that they're
Mhm.
culturally responsive and, working to be anti-racist constantly, all of these things.
What policy changes are needed to reduce racial trauma and promote racial equity in healthcare?
When we're looking at policies, we really need to look at anti-discrimination legislation. We need to look at health equity mandates, implementing that in the healthcare. If you're in a position of leadership, if you do not have a policy to enforce harms against racialized trauma, then that means you're setting up an open door for that to happen. We need to have culturally competent care standards. I mentioned earlier the mandated trainings and more than an hour. We need to actually be putting dollars and money funding these, because oftentimes we'll hear, oh, we don't have a budget for that this year. So if you didn't have a budget for that, that means you didn't plan to protect
Mm,
people of color. We
mm.
need language access services. We need community-based health interventions. We need implicit bias trainings. There's a wonderful gentleman. He does a lot of work around implicit bias. He's a medical doctor. I can't think of his name right now. But the work that he does is really groundbreaking. And I would say implementing something like that within your work environment, having a healthcare work diversity team and not mandating the Black and brown folks that are in your already employed, actually hiring someone who has the background, has the training, has the experience, keeping them employed, ensuring that there's a budget for that. Looking at data collection and reporting. We talked earlier about what methods and tools are there. Well, there's not a lot because there hasn't been funding for it. The research
Mm.
hasn't been there for it. So putting money into it, really looking at engaging community.
Mhm.
What does the community want to see? How is the community feeling about this? Forging partnerships with people in the community who've experienced this and are really working toward addressing health equity, addressing racial trauma, and holding folks accountable. Because we'll have policies in place and then it's like, we'll turn a blind eye to it. It's written on paper and it looks real cute, but no. So really holding ourselves accountable to it. And that may mean even enforcing a specific team who's there, making sure that there's a safe space. Oftentimes people don't feel comfortable going to HR. They view HR as working for the company and representing the organization, not necessarily representing the employee. And no matter how much we say that's not true, or we tell people HR is there for you, it's still ingrained in the mindset at this point. So we
Mhm.
need to create other systems to hold folks accountable. And I would say those would be some of the things we could start with in terms of just policy initiatives, legislation, and it, looking at your local council. Who are you putting in office? Who are you voting in the ballot? What are their
Mhm.
initiatives? How do they feel?
Mhm.
Do they feel like this country isn't racist?
Mhm.
I'm not gonna call out any names, but looking at stuff like that.
Good deal. Good deal. Great points there. And our last question for the evening. Where do you see the future of efforts to address racial trauma in healthcare heading?
That's a really scary and difficult question to answer. If you would have asked me this a couple years ago, especially during the height of the George Floyd protest and where things seem to be going and moving in a positive direction for
Mhm.
change and folks just not standing for these systemic issues, these harms anymore, I would say I would feel like it's going in a great direction. But now we're in a time where we're banning books. It feels like we're going backward. So I don't know what the future efforts are. It seems pretty bleak when you're looking at polling and who's in the lead and where they stand. We could be going far back. I would like to be optimistic, but I'm also a realist. So where
Mhm.
do I see it going? If I had my voice, and I, could wave my magic wand, we're going to a world where I don't need to do the work that I'm doing anymore. We've got a whole anti-racist world. We've got these systems in place. We've got these tools, these data
Mhm.
trackings, all
Mhm.
of these things. That's where I would like to see it. But is that the reality of it? I honestly don't know. Talk to me after this election year and let's see.
Well, we definitely want to come back and talk. And again, I would like to thank you for making the time for us out of your very busy schedule um, to have this conversation with us. And I definitely want to invite you back so we can continue this conversation because it will be an ongoing conversation. So again, thank you, Ashley, for joining us today.
Absolutely. Thank you for having me.
And to our audience, thank you for tuning in into this podcast. I'm quite sure it's very informative to all of you practitioners and healthcare executives and leaders out there, giving you more insight and information about the changes that we need to make and how we work collaboratively together to make this happen. So thank you for tuning in. Please remember to share, like, and subscribe to this podcast.